Hi Becky, thank you for coming to talk to us today about Medicaid expansion. I just wanted to ask maybe for you to provide a little bit of background on who you are and what you do and maybe why you do it.
Okay, I'm Becky Bowers-Lanier. I am a nurse by trade, and for the past 11 years or so I've been working as a lobbyist or an advocacy consultant. And my clients are mostly healthcare related, some disease conditions and some healthcare provider groups, as well as a few clients that mainly have a domain of interest in kindergarten through 12th grade, but they're also healthcare, like school nurses and athletic trainers and those kinds of things. I have been interested in this particular topic of Medicaid expansion for some time because, and I have to tell you, my waiver here is that I believe that everyone should be covered by some sort of health insurance. And so I am a supporter of Medicaid expansion personally, and I've been working for clients that have the same background, although we'll be talking about the opponents to Medicaid expansion. I have 2 degrees in nursing, a bachelor's and a master's, and a doctorate in higher education administration, and a master's in public health. I like to go to school. And so I think that makes me qualified to a certain extent to be able to do this work, although you don't necessarily have to have all kinds of degrees to be a lobbyist.
Right. So I think it'd be great if you can give a little bit of an overview of the current Medicaid expansion, maybe at the national, federal level, and then maybe talk about what's going on in Virginia.
Sure. And I will consult my notes for this because I wanted to make sure that I was giving accurate information. The Affordable Care Act, when it was passed, was originally designed to do a number of things. One, to increase the numbers of individuals who have access to health care, primarily through the adoption of commercial health plans, health insurance plans, not a universal health care like is present in so many other countries where the government is providing for health care. And that's really because we've had a fairly significant and robust employer provision of health care through insurance plans for a long time in the United States. And so we've got a relatively strong health insurance lobby that keeping the status quo, in other words, making sure that people have health care insurance seemed like the way to go here for that. So that's part of it. Part of it was also to bend the cost curve to a certain extent, and that was that if you look at the background around healthcare insurance, you can see that the costs have gone up and up and up over the years. And so the act was designed to slow down the cost of healthcare, provision of healthcare over time. And so that's another thing. Third provision was to increase innovation and by the use of technology and other sorts of things, so that the old way of doing things and providing health care were okay, but the government would really like us to move in the direction of creating innovation. And so that was another provision of the Health Care Act. It's a very large act. I've never read it. It's over 1,000 pages long. I wasn't about to read it. The areas of concern for us in Virginia have to do with, the other one was to provide an individual mandate. And so an individual mandate that people get insurance. So if it's not provided by the federal, by their employer, then individuals could go on an exchange that was created in Virginia. We have a federally facilitated exchange, as in the majority of the other states. So that you could go on the exchange like you would go to Amazon, for example, where you get onto Amazon and you say, I'm interested in this particular product. And you can buy it from Amazon, but it also gives you a full menu of other providers that will sell you that product, and you can determine whether you want that particular product at this price or that. So that's the exchange. And in Virginia, we've implemented the exchange on time for individuals who need to purchase health care insurance. And those are the ones who don't get health care provided by their employers, health care insurance provided by their employers. Unfortunately, as the act was implemented, or fortunately, depending upon your position, individuals who make less than 138% of the federal poverty level are not eligible to go on the exchange. They don't make enough money to purchase health care insurance, and for those who are up to 400% of the federal poverty level now get subsidies by the federal government to help them pay for insurance. But people who make under 138% of the federal poverty level are not part of the exchange, can't purchase health insurance through the exchange. And so they have a coverage gap. And for that, the provision of the act was that states would expand their Medicaid program to cover those individuals. But the Supreme Court, in its decision about the Affordable Care Act, determined that that the federal government could not order or mandate that states expand Medicaid. And so what's left is states have the individual option to expand Medicaid. And that's put us in the position that we're in right now, whether to expand Medicaid or whether not to.
That's a great overview. So I think to give the audience a little understanding is to ask kind of who is kind of pushing for Medicaid expansion at this point in Virginia?
Yeah, that's a good question, because if you think about stakeholders who would benefit from Medicaid expansion, you want to think about those who would directly benefit, i.e. people who don't have health insurance, and those who would sort of indirectly benefit. If we go in the direction of having insurers, a commercial insurance plan, you could see that the health plans would be supportive of Medicaid expansion. Another provision of the Affordable Care Act was that over time, right now the federal government subsidizes hospitals that provide indigent care. So I don't have health insurance, I have an asthma attack, I go to the emergency room, it costs money, I can't pay for it. The hospitals can get reimbursed for that care by the federal government. With the assumption that all of the states would expand Medicaid, under that assumption, and if Virginia would expand Medicaid, I go to the hospital for my asthma attack and by the way, you're not enrolled in Medicaid, we can enroll you right now. And then the hospitals would be able to bill Medicaid for the care that they give. So over the next few years, that's called, the subsidization that they currently get from the feds is called federal disproportionate share, or they DSH, D-S-H. DSH payments are going to go down over the next few years. Therefore, hospitals are very much in support of Medicaid expansion because they're looking at a decrease in funding from the feds for the care that they now provide and that they're mandated to provide by federal law. Anybody who goes to the emergency room has to be seen, has to be treated, regardless of your ability to pay. That is a federal law, been in effect for years. So they're in a bind. DSH payments are going to go down, therefore they want to expand Medicaid. The other people who are in support of this in general are chambers of commerce and local governments for reasons that I can explain in a little bit. But so we've got those folks who are in support. If you think about the people who might be opposed to Medicaid in general, people who believe that we are already spending way too much money on Medicaid in Virginia, people who would believe that perhaps you can't trust that the federal government will pay for it, and we'll talk about that in a few minutes. Those who say that the government already does too much, and therefore we need to, we don't need to expand government anymore. People who believe that individuals who need health care can already get it. They go to emergency rooms. They go to free clinics, they get care from others, or they don't get care, but if they went to work for an employer who would provide them with health insurance, they would be able to get care. So that's kind of the argument that goes back and forth. I haven't talked about the politics, and the politics are really overriding all of this.
Right. So given the current Medicaid expansion situation in Virginia and the debate around expansion, what do you kind of see as the next steps for either from Richmond or just the state in general?
Okay, let me back up for just a minute and make sure that You know, you have, I can give you a better argument on either side of this, because I want you to kind of understand that, and for the people who will be viewing this, there are some places that you can go to get more information about this. But I want to give you a little bit more of a background on that, because the argument is that we already are investing 22% of our budget into Medicaid. Why do we want any more? I will also tell you this, that in terms of Medicaid spending in the United States, out of the 50 states, Virginia is 48th in spending. We have because we don't cover adults now, we really have very few people covered by Medicaid. The opponents would say that we already invest too much money. The other part of this is that the Affordable Care Act will pay for 100% of the Medicaid expansion for the first 3 years, and then up to 90% of Medicaid costs to the year 2022. And after that, it gradually goes down to 90%, and then after that, stays at 90%. Right now, our Medicaid proportion is 50%. State pays 50%, feds pay 50%. With this Medicaid expansion for the next 3 years, starting January 1st, 2014, the feds pay 100%. How much money does that come out to? It comes out to $1.9 billion a year that the feds will bring to Virginia to pay for these individuals who currently fall into this gap and have no health care insurance whatsoever. That's a lot of money. That's like $10 billion over the next decade. Actually, the next 5 years. So what we're doing is, you know, the proponents for Medicaid expansion would say that taxpayers are paying for that money, they're sending it to Washington, and we're not getting it back. And we still have to pay for the care of individuals with health insurance. So that kind of the background that I think it's important for people to know, for those who are proponents of Medicaid expansion. We're paying for it now, we're not getting it. And we need to get that. The opponents would further say that because we already have 22% of our budget going to Medicaid, we can't afford to give any more money to Medicaid. Medicaid is inefficient, it's full of loopholes and fraud, and we ought to get rid of all of that, increase efficiencies in Medicaid so that we would have less money now being paid for Medicaid. We can't trust the federal government to be able to live up to its bargain. So, you know, how do we know once we get into an expansion of Medicaid that the feds will not continue to give us the money that they said that they would for this expanded population? By the way, there is a provision in the law that says that if the feds renege on their commitment, then we can get out, we can opt out of Medicaid expansion. So I think that kind of gives you a little bit more of a flavor for what we're facing. So we've got people on the one side who say, yes, we need to do it for economic reasons, we need to do it for moral reasons because we have an obligation to take care of people who are ill. And then we have people on the other side that says they say we can't trust the feds. They will already spend too much money, and Medicaid's a broken system to begin with. So why expand it? That's basically the argument on both sides. So now you asked your question again.
What I was saying was just there was a lot of debate over the budget, including the Medicaid expansion. They did pass a budget and without the Medicaid expansion. So maybe if you want to talk about what you kind of see it going forward, and maybe the people that are proponents of Medicaid, what they're going to probably do in the state.
You're right. What happened was the governor ran on a platform of expanding Medicaid. The opposition ran on the platform of not expanding Medicaid, in fact, repealing what they call Obamacare. That debate of repeal seems to be diminishing now, although the public is still mixed on its feelings about Obamacare, ACA, Affordable Care Act. And we're not here to discuss that so much. But the context for passing a budget without Medicaid expansion swirled around power and control. And The Republicans in the House of Delegates have a veto override majority. They have 68 members of the House who are Republican. And so they could override vetoes that the governor might make on the bill, so a budget bill. So if the budget bill had something in it for expanding Medicaid or closing the coverage gap, the Republicans in the House of Delegates could say, you know, they could override the governor's veto, or they just not put it in. The Senate, on the other hand, was a little bit different. The Senate had 20 Republicans, 20 Democrats, and about 3 weeks before the budget bill was passed, one of the Democrats resigned abruptly, leaving the Republicans back in control of the Senate. That changed the whole dynamic about moving forward on getting the budget bill passed. The budget bill was passed, but not only that, in the debate about the budget bill, the Senate put in an amendment that says that the governor cannot expand Medicaid unilaterally. No way, no how, until the General Assembly approves expansion of Medicaid. So not only that it has no expansion of Medicaid in the budget, but also they can't do it without, he can't do it unilaterally. The governor, on the other hand, said, I'm going to expand Medicaid regardless, and said to the Secretary of Health and Human Resources, come to me with a plan by September 1st that will expand Medicaid without legislative approval. Republicans have said to that, you do that and we're going to sue you because that is unconstitutional. We're going to take you to court. And so that's where we stand right now. The Republicans in the House and in the Senate, with the exception of 3 Republicans in the Senate, who do support some sort of way to close the coverage gap, and they have been supportive of a commercial insurance type plan where we would get the money from the feds, and then similar to what currently exists in the marketplace, in the exchanges, people who would be eligible, childless adults between 19 and 65, who make less than 138% of the federal poverty level, could go to the exchange and purchase health care insurance, which would be entirely paid for by federal funds. So they have been supportive of that. So they're in a slight majority still, but the House is not supportive.
I guess one final question would just be, what can constituents do to learn more about this issue and also maybe become involved in the process?
Yeah, I think on both sides. For those who want more information, you can get on our Health Policy Collaborative website here at JMU and take a look at that. We've got links for proponents and opponents of Medicaid expansion. We would like people to sort of make up their minds about this, and by looking at what the various groups have said. The proponents, as I said before, are patients, but they are represented by Virginia Organizing, which is a community organizing group around social policy issues. There is a coalition of over 100 healthcare organizations called the Healthcare for All Virginians Coalition, HAV, we call it HAV Coalition, which has been supportive. Hospital associations, as I've said, Chamber of Commerce. We've got some clips, news clips, where you can look at other groups that have been supportive. And of course, we have an executive branch that's supportive: governor, lieutenant governor, and attorney general. The opponents are from the Cato Institute, CATO Institute, Heritage Foundation, and for the most part, and a national group that has the acronym ALEC, which stands for American Legislative Exchange Forum, and they have on their website a whole series of, they want repeal of affordable care and have proposed a whole series of laws that could be put in place instead of the Affordable Care Act. So I think you need to look at both sides of the issue and make up your own mind. And so, you know, I would say that it's some of the arguments for opposing this seem more political to me. On the other hand, those who are opposing Medicaid expansion would say that the arguments in support of Medicaid are political. So we've got a political battle that's going on, and the individuals who stand to win or lose are those who right now are not able to get health care because they're not making enough money to get health care.
Well, thank you so much for your time today.
It was fun.
Educating us about Medicaid.